Good day, everyone, and welcome to this presentation from WHO PQS entitled WHO PQS, Your First Line of Defense. Let me just say a word about the title itself. I think people will wonder why we chose such a title. PQS is the first line of defense because if we go back to the time when there was no regulation of the cold chain market, it was difficult to tell whether vaccines being administered were potent enough to achieve the disease control objectives of the program. There was limited temperature monitoring, and most of the storage equipment was not suitable for the socioeconomic context in which the equipment were being used. Just as an example, the introduction of long holdover devices greatly alleviated the effects of unreliable power in the immunization program. PQS, for those who don't know, is responsible for the development of standards for immunization equipment, as well as the pre-qualification, which means the assessment of this product for WHO listing. Also to note that PQS is not limited to cold chain equipment. We also develop standards and pre-qualify equipment for the administration of vaccines. Before I go any further, let me introduce the team which participated in the development of this presentation. So myself, I'm Gobina, and I work at the WHO PQS Secretariat. With my colleague Paul Mallins, we work together at the WHO headquarters, and we manage the day-to-day running of the PQS program. We also have Edda Magnus, who is a post-market monitoring project manager at PATH, supporting PQS. For the past almost 2 years. We have Léon Kapenga from DRC country office for PATH, who has also been supporting managing the post-market monitoring program in DRC. We have, last but not the least, Denise Habimana, who is at the Geneva PATH office and supporting the PQS program on a daily basis. Next. So just to give you an overview of the contents of our presentation. So we'll start with a little stock take of what PQS has been doing over the past 15 years. That will follow immediately after this. And then we'll have a progress report of PQS activities since the last TechNet, which took place in Portugal in 2017. And then we'll have another presentation on ultra-low temperature devices. As we know, these have been used for Ebola and potentially, given the COVID situation now, potentially for COVID vaccines as well. As I mentioned in the introduction, a couple of our staff supporting us in post-market monitoring of cold chain equipment in 4 countries. And we'll have a kind of report on what these activities have resulted in so far. Next. So PQS, the pre-qualification program for cold chain equipment at WHO, I mean, we describe it as the bedrock of immunization supply chain, because before the health workers open the fridge in the morning at the health center They are sure that this equipment has gone through all the testing, which the standards of which are set by WHO PQS, and they are sure that this equipment are able to protect the vaccines which are used for the program. The 1 billion doses of vaccines which are procured every year go through PQS pre-qualified equipment, or are monitored by PQS pre-qualified temperature monitoring device. Between 2015 and 2020, PQS developed 56 standards. That's a huge amount if you consider that one standard at times will take 9 months just to develop. So concurrently, we had to be developing several standards at the same time, which is a huge task for us. Within this period, we also pre-qualified 141 products. The big highlights of the coming standards we are developing is the portable fridge. Hopefully this will help at the last mile because you have situations where health workers have to go to far away villages and spend the night. If you have a device which can be charged and used remotely, that would be a very good plus to the program. So after this introduction, I'll pass over to my colleague Denise, who will give us an overview of the developments which have happened in PQS since the last TechNet. Over.
Next slide, please. Hello, everyone. My name is Denise Habimana, and I'm a PATH program officer based in Geneva, Switzerland, supporting the WHO PQS initiative. So a lot of great work and progress has been made since the last TechNet conference in 2017. 25 performance specs and testing protocols have been published across multiple PQS equipment categories. Examples include specifications for freeze-free vaccine carriers, combined VVM and threshold indicators, and single-phase voltage stabilizers. These specs ensure the quality and safety of key features and functionalities of immunization products and devices used in the field, such as voltage regulation, energy harvesting, and freeze protection. Next slide. WHO PQS is also in the process of launching a brand new website. In addition to being a one-stop shop for all things PQS, the website will have dedicated portals for different stakeholder profiles, with content curated for manufacturers, testing laboratories, procurement agencies, and product users. Communication is key to PQS's work, which is why PQS has increased its engagement with countries to understand user needs and with manufacturers to help transform those needs into PQS products. Next slide. In addition to user needs fostering product improvements and innovations, WHO PQS depends on the immunization community to share their feedback on current PQS products. This feedback not only helps strengthen product specs, it also allows PQS to take the necessary steps with manufacturers to address identified issues. Next slide. Another positive development since the last TechNet conference is that failure reporting is now a requirement for all manufacturers with PQS products seeking annual revalidation. With the help from the immunization community and manufacturers, WHO PQS has been able to create a data repository of equipment performance issues. This data repository, where performance issues are tagged and ascribed to specific specs and/or manufacturers, set the stage for what will become the new WHO PQS post-market monitoring workstream, which my colleagues will describe further in the next slides.
Thank you very much, Denise, and greetings to everybody. Hello, my name is Paul Mallins, and I'm Isaac's colleague at the PQS Secretariat in Geneva. Denise just outlined that we have a new work stream where we're proactively seeking pre-qualification feedback. Feedback is key to assure the performance and the continual improvement of cold chain equipment. Currently, we do not have an effective, systematic post-market monitoring feedback on cold chain immunization equipment. We do the specifying, as Isaac mentioned. We do the testing. We pre-qualify. The equipment is then purchased and sent to you in the countries. But we do not get a lot of feedback. We don't hear very much. We do not get a lot of information on the performance of that equipment once it's in the countries. So this is a request. We're requesting your support and engagement with us on performance feedback. We especially request national EPI colleagues who are working every day in the program, and their partners to provide to us actionable and detailed equipment performance feedback. You can see here the PQS homepage. There's a feedback button on it, and we encourage you to report back to us on issues that you're having with equipment. Your feedback will assist in shaping our specifications and lead to quicker resolutions of performance issues. You can have a real impact on improving cold chain equipment for everybody. What will we do with this feedback? Well, we have two very clear aims. The first one, if we can identify an issue which is directly related to the specifications, it is within our mandate to change, to revise, to update that specification. And if the issue identified is a quality issue with the product, we are able to very quickly to contact and work with the manufacturers to solve the problem, to work in a timely manner to get corrective and preventative actions. In both cases, you can play a really vital role in improving the quality of the equipment for everybody. So we really look forward to hearing from you. Please hit that button. Next slide, please. So I'd like to inform you now about the post-market monitoring pilot project that we are currently running, supported by partners. So what we're looking to do in this pilot is to systematically track cold chain performance data for the same two reasons I also mentioned. We want to inform and be able to revise our specifications and testing procedures based on real detailed feedback, which you can help to provide to us. And when we have detailed, actionable feedback, we can work quickly in a timely manner with manufacturers to solve the problems, and the result being we will end up with better cold chain equipment for everybody. So in this pilot project, we are testing the feasibility and the effectiveness and the reproducibility of a set of tools. We're seeing if this methodology that we've devised is going to be effective in producing the actionable feedback that we're looking for. If the methodology works well, remember this is a pilot, if the evaluation shows that the methodology is both useful to us to improve the quality of cold chain equipment and of course for countries, then we would aim to integrate PMM, post-market monitoring, into national EPI programs. And of course, we would support this with a tool of guidance and a suite of tools and guidance material, which we are currently testing in this pilot. Next slide, please. So I'd now like to give an overview of what that methodology is. So we would like to thank the Gates Foundation, who funded this pilot project through an existing grant to PATH. And so thank you to the Gates Foundation for the funding, and thank you to PATH for for the management and logistics support to implement the pilot. We're in 4 countries, in the Democratic Republic of Congo, in Haiti, in Pakistan, and in Bangladesh. And the first data we collected was in RDC in January of this year. Our partners who are implementing on the ground, in DRC, it's PATH itself. In Haiti, it's the Solar Electric Light Fund. And in Pakistan and Bangladesh, it's Interactive Research and Development. So the program has hired 1 surveillance officer in each of the countries, and they have additional support from their organizations, but it's essentially 1 full-time surveillance officer over a period of 15 months. 3 months for the setup phase and 12 months for collecting data and implementing root cause analysis. And of course, it's done in very close collaboration with the national EPI programs. So why sentinel surveillance? So we chose this methodology to have a targeted selection of sites with a broad representation of different makes and models of cold chain, and essentially in sites where the healthcare workers were both willing and able at the facility level to provide the required monthly feedback. So this is monthly zero reporting against a very limited set of 8 indicators, which will trigger potential issues with product performance. Mainly these are temperature indicators. So the way it works, when the indicators trigger that there could be a potential performance issue with the cold chain equipment, that the surveillance officer, along with the national EPI, along with the local, EPI technician, they go to the facility and carry out a root cause of failure analysis to really dig down to see, is it genuinely a performance issue, or is it maybe a power issue or a human resource issue? Remember, we're looking for, at PQS, we are interested in the product performance issues. So the root cause failure analysis is the core of this program. We have a trigger from an indicator, and then an assessment is done by qualified technicians to find out the real issue with the performance. We're testing this to try to produce something that's low cost, that's relatively simple and easily scalable and replicable. And the pilot is building this and testing this set of tools now. So I'm now going to hand you over to my colleague, Edda Magnus, who's going to provide some more information on these tools and the initial learnings from the pilot. And we look forward to being able to report to you in Q2 of next year of the outcomes of the PMM Sentinel surveillance. Thank you.
Thank you very much. Thanks, Paul. So my name is Edda Magnus, and I am the project manager for the PMM pilot project, and I'm based at PATH in Geneva. So as Paul said, I was going to talk you through a couple of the tools that we're testing as part of the PMM pilot project. Now, to ensure that we have standardized and simple tools for the monthly data collection, we have decided to introduce and test ODKX for the data collection for PMM. Now, ODKX is at its core an inventory and maintenance application for cold chain equipment that has been developed by the University of Washington in Seattle. Now, if you're interested in the detailed functionality of ODKX and its core functionality of inventory and maintenance, I would invite you to listen to a presentation from the Uganda EPI, who will be presenting what their learnings and lessons coming out of a pilot project that they've been running this year on ODKX in Uganda. Now, for the PMM pilot project, on top of the inventory and maintenance functions of ODKX, we have added additional functionality which allows for the monthly PMM data collection based on the PMM indicators. Now, we see a huge benefit in this because this really allows us to link the monthly reporting on cold chain equipment failure and issues directly with the inventory and subsequent maintenance if needed. And going forward, we will be adding additional functionality to OTKX, which will allow for the automatic uploading of temperature data through fridge tag tools into the application, which is currently something that's being done manually. Now, we're rolling out OTKX gradually in the 4 pilot countries, and we aim to have all 4 of them using the application for the data collection before the end of this year. In the meantime, we are using an Excel sheet that has been prepared as well for the data collection. So that also forms part of the overall toolkit for PMM. Next slide. So the second tool that we're also testing as part of the PMM pilot is a taxonomy of cold chain equipment failure. And this taxonomy basically provides clear terms and definitions for all the key words we need to use to describe cold chain equipment and potential failures. And the aim here is really to try and standardize the way in which we describe and talk about cold chain equipment and failures. This now exists both in English and French, and we have been integrating this taxonomy and the terms and definitions into all the tools and guidance that we are developing for the PMM pilot. The taxonomy will be available on the PQS website very shortly. And just to refer back to what Paul was highlighting before, that we really want you to try and use the PQS website as an opportunity to report on any issues that you're seeing. When you do report, please use the taxonomy so we can move towards a more standardized way of talking about the issues that we are experiencing with the cold chain. Next slide. So just to give you a bit of an overview of the PMM pilot so far and some of the lessons that we've been learning. As Paul mentioned, we've been collecting data since January of this year across 4 countries. So each month we are receiving data on more than 250 fridges from almost 160 different sites across these 4 countries. We have data from 6 different manufacturers and numerous makes and models of fridges. Now, what have we learned so far? I think one of the key learnings that we've seen from the pilot so far is the importance of a very focused and thorough preparation phase. So where we've seen the most success has been in countries where time and effort has been put into building strong relationships with EPI management, both at central level and local level, and where time has been put into building strong relationships as well with the health center staff who are going to be reporting on a monthly basis, to really make sure that they fully understand the objectives of the PMM pilot and they understand the tools and the methodology. So we've seen that where this is done well, it is possible to receive monthly data and monthly reporting from all sites without any major follow-up or supervision. And we've also seen that it is possible to do this remotely through either WhatsApp or telephone. But this really is based on the fact that the preparation phase was done thoroughly. Now, the second thing that we've also seen is that while we can quite easily receive data and reporting monthly on cold chain equipment failures or performance, if there is a failure or performance reported, it is very, very important to follow that up with an in-person visit to the site. Remote investigation or follow-up does not provide enough detail. It is necessary to actually visit the site with an EPI, local EPI technician, to really investigate and understand the causes of the failure. I think the third key lesson that we've learned is that we've seen with the PMM pilot that it has really helped to improve inventories. As we all know, inventories are often incorrect and incomplete, but we've seen really with the PMM pilot that it has been an opportunity at the health center sites and provinces where we've been working to really update the existing inventories that are available. So that is all from me. I'm going to hand over now to Dr. Léon Kapenga from PATH DRC. À vous, Dr. Léon.
Thank you. Hi, everybody. I'm Léon Kapenga from DRC. I would like to share the experience of PMM project in our country, particularly in the COVID-19 period. As everybody knows, this pandemic came into countries and led to lockdown. So how did we manage the data collection? So when the COVID lockdown occurred in the DRC, the PATH managed PMM project, moving it from data collection by a positive action to remote data collection. And we did this through WhatsApp application. It was possible to do this throughout the lockdown period, and we continue to report monthly. So how successful of this transition from active data collection to remote data collection was particularly due to a well management of preparation and to the good long-term agreement that we had with network operators. As everybody is aware, internet connection in Africa is not free of charge. So PATH took this opportunity to capitalize on his good relationships with network operators. We could order gigabytes and airtime for Sentinel sites from Kinshasa without any problem. There was also a challenge that I would like to state. The challenge we faced on this project was particularly failure of that alert analysis, because we could not go to the field, as my colleague have said. Second, the project manager who has been managing the project was blocked himself in the field. And from there, we continued to work from his hotel and the sub-office of PATH in Kalemi. So he stayed there till the lockdown was lifted. So what is important to know is that data collection from all sites to the period of COVID-19 in the DRC continued despite the lockdown. And now that the lockdown has been lifted, we are working now to catch on to all the situation that needs investigation with the API team. A valuable stress was also on the methodology of this pilot. And thanks to God, we succeed to have a low-cost remote monitoring of cold chain. That's all I can share. Thank you.
Thank you, Léon. And maybe it's a good transition from how the DRC adapted to the COVID lockdown to how PQS is preparing for the COVID vaccines. So I'm going to talk to you about the work that PQS is doing on ultra-low freezers. First of all, why ultra-low temperature freezers? We know that at least one of the Ebola vaccines currently in use requires minus 80 degrees storage. And there is a high probability that at least one of the candidates for COVID vaccines will be needing ultra-low storage as well. So we think that countries should potentially be preparing themselves for such an eventuality. And PQS being the, as we said in the beginning, being the first line of defense, has stepped up to the task of developing standards for ultra-low freezers. So on this slide, we have a typical ultra-low vaccine supply chain setup. This is inspired mainly by the Ebola work in DRC and in West Africa. The upper half represents the active cold chain parts, so like the freezers and the fridges, while the lower parts represents the passive cold chain. The main components of a typical ultra-low vaccine supply chain are the -20 freezer. So these are used to pre-freeze the PCM packs because it's easier to move from room temperature to -20 and then to -80 rather than moving directly from room temperature to -80. So the -20 freezers are used to pre-freeze the PCMs. And then you have the ultra-low freezers, which are used for two things. First of all, to freeze the pre-frozen PCMs from -20 to -80, and also for the long-term storage of the vaccines themselves. So once the PCM packs are frozen to -80 degrees, they are placed in long-term passive boxes, which are used for the transportation of vaccines from the higher level of the supply chain to the health facilities, where these vaccines are stored between 2 to 8 prior to administration. Next. Typically at PQS, the process for development of standards take between 9 months and 12 months. But given the urgency for ultra-low freezers, we have tried to compress this process. So in July, what we did was to create a working group to review current standards for ultra-low freezers, as well as technologies which already exist. We came up with a first draft of the specification, and then we've done a review within the PQS team. Currently, we have that draft out for manufacturers, the cold chain industry to review. We'll be having an industry consultation in November, which will help us to interact with manufacturers and to get their opinions on the current draft. And then hopefully by December, we should be able to publish. Next. Some highlights, we can't go into details on the specifications at the moment, but I can give you some highlights on what we are thinking about. So the scope covers requirements for compression cycle ultra-low freezers for storage of vaccines, as well as for the freezing of PCM packs. We hope to cover 3 temperature zones: hot zones, moderate, as well as temperature zone equipment. It is also anticipated, but that will depend on what the industry feeds back to us, that in certain situations, these freezers might have to work in temperature controlled environments, so probably air conditioned rooms, because of the temperature differential between very hot environments and the requirements for the freezers to work right down to -80 degrees. So that will depend, the third points there will depend on what we get as feedback from the industry. In terms of the thermostat settings, we are also thinking of having either 2 or 3 settings, depending on the type of vaccines, as well as also to make sure that some ultra-low freezers can also fulfill the role of -20 freezers. So we might have 3 temperature set points, But of course, this also depends on what we are going to be fed back from manufacturers. In terms of the power supply, our thinking is to have continuous power supply, given this temperature sensitivity of these vaccines. And for this, what we have done is to develop a separate specification just for the power supply of the ultra-low freezers. So it's a whole package which comes with the freezer specification and the specification for the power supply of the freezers. Next. So that was highlights for the active. Now for the passive, what we plan to do, and this work has not yet started, but we hope to move very swiftly on this, is to adapt the long-term passive cooler specifications, and also to develop new specifications for minus 80 to minus 60 PCM packs. Currently, we don't have specifications for removable PCM packs, but given this need, we plan to develop these specifications. What was used for Ebola was not, there are no specifications for that as far as PQS is concerned, but we hope to be inspired by that experience from Ebola. There's also consideration for safe disposal. Most of these PCMs are corrosive and highly flammable. So we'll have to think about how to specify such that accidents and incidents are actually highly reduced. Also, having data loggers for very low temperatures is not very easy, but of course, given the evolution of technologies, we now have some data loggers in the market. So we hope to specify the performance of the data loggers used as well for these passive devices. Of course, the temperature ranges being used here are highly dangerous for manipulation. So we also hope to specify personal protective equipment such as gloves and screens and so on. Next. Yeah, so learning from the Ebola experience in DRC and West Africa, we think that countries will have to retrain their staff and to also prepare for large-scale vaccination with ultra-low cold chain, which is not an easy task. So, for example, ultra-low frozen PCM accumulators must be replaced every 5 days if we have to maintain the temperature below minus 60 degrees. So a whole machinery will have to be developed to make sure that there is efficient recycling of the PCM packs. And then, as I said in the first slide, the PCM packs are usually pre-frozen using ordinary freezers to minus 20 for 24 hours before they are used in the ultra-low freezers to bring them down to minus 80 degrees. So these are just highlights for countries to think about. Hopefully, by the end of the year, we will come up with more comprehensive SOPs for managing such a cold chain supply system. Next. So some key messages to take home. Large-scale introduction of ultra-low temperature vaccines will require considerable adjustments and investments in the vaccine cold chain. Considerations on procurement of new equipment, because of course, this equipment don't exist in most countries. apart from a few countries who have had the Ebola vaccinations. There needs to be thinking around training of health workers in the management of such a supply chain. And of course, the power supply is a big component of this. And that's why, given the importance of power supply, that's why we developed a special specification just for the power supply for ultra low. So we hope to be able to meet the timelines for any new vaccines for COVID. As I said in the slide above, the specifications for the active will be ready by the end of this year, and hopefully early next year we should have the specifications for the passive cold chain equipment for ultra low vaccines. Next. Yeah, so just important reminders, as Paul said earlier on, we are not receiving feedback from the field. You have the link here. If you have any communication, any complaints about the PQS equipment, just go to the PQS website. There is a feedback button. You can upload documents as well as photos with your reports. And of course, you can always reach us by email as well, right on that slide. So that's all I had. On behalf of the team, thank you so much for your kind attention. And if you have any questions, we'll be ready to answer them. Thank you.